morning, everyone. Today we'll see heme metabolism. In this, first I will be telling you about structure of heme and types of abnormal hemoglobin. In this, specific learning objectives are: students should be able to outline the structure and functions of heme, enumerate normal major types of hemoglobin, enumerate hemoglobin derivatives, outline the types of abnormal hemoglobin, classify hemoglobinopathies, and enumerate the salient clinical features and management of each type. Hemoglobin is present in this tiny spherical RBC. RBC is a biconcave disc. Hemoglobin, it is the allosteric tetrameric protein. It belongs to the conjugated protein, and it is also classified as transport protein because it has got function of carrying oxygen from lungs to the tissues and carbon dioxide from tissues to the lung. It contains heme as non-protein prosthetic group and globin as protein group. Non-protein part, it contains protoporphyrin 9 with iron. Iron is present always in the ferrous form, so that it carries its function of carrying carbon dioxide and oxygen. And globin as protein, apoprotein part, two types of chains are there. 2-alpha, each chain contains 141 amino acids, and 2-beta, each chain contains 146 amino acids. It has got molecular weight of 67,000 Dalton. It is a red pigment which is present in the erythrocytes. Then alpha gene is present on the chromosome number 16, and beta gene, it is present on chromosome number 11. Embryonic hemoglobins, these are the embryonic hemoglobins, Gower 1, Portland, Gower 2. These are produced from 3rd week to 3rd month of the pregnancy, and fetal hemoglobin starts from 2nd month to 6th week of the pregnancy. Now these are the normal types of hemoglobin. Hemoglobin A1, about 90% of adult hemoglobin is present. It contains alpha 2 beta 2. Hemoglobin A2, which contains alpha 2 delta 2, less than 5%. Hemoglobin F, that is fetal hemoglobin, it is less than 2%, or it is totally replaced by adult hemoglobin by the end of first year. It contains alpha 2 gamma 2, and this is glycosylated hemoglobin, which is helpful in the prognosis of to see the prognosis of diabetes mellitus patient. It is normal level is about less than 5%. Now we'll see the structure of heme in brief. This is the structure of heme. It is a tetrapyrrole structure. Pyrrole rings are numbered as in the Roman letters as 1, 2, 3 and 4, which are linked together by the methine bridge, which are designated as alpha, beta, gamma and delta. While the substituents which are present are methyl, 4 methyl groups are there, and 2 vinyl and 2 propionic acid. This is asymmetric type. Asymmetric type of porphyrin is always present in the human being. So iron is always present in the ferrous form. It has got 6 valencies linked by the 4 nitrogen of the heme ring, and a molecular oxygen, and 1 to the globin chain. Now heme is present, it is a hemoprotein. Now the types of hemoprotein, these are example of hemoprotein are hemoglobin, myoglobin, cytochromes. In cytochromes, iron is present in ferrous and ferric form. It is also present in enzymes like peroxidase, catalase, tryptophan pyrrolase and nitric oxide synthase. Hemoglobin, when combines with different ligands, forms hemoglobin derivatives. Like when it gets combined with oxygen, it is called as oxyhemoglobin. Then carbaminohemoglobin is when carbon dioxide gets attached to the hemoglobin. Methemoglobin, when iron is converted into ferric form, and carboxyhemoglobin is when carbon monoxide is attached to the hemoglobin. In this, the hemoglobin will lose its capacity of carrying transport, that is carrying oxygen and carbon dioxide. Now we'll see what are abnormal hemoglobin. So this may be due to the mutation in the gene that codes for alpha and beta chain or globin. The globin genes we have already seen are organized into two gene families or cluster. Alpha gene family and beta gene family. Alpha gene family is alpha 1, alpha 2 and zeta, and beta gene family, these are beta, delta and epsilon. Then the term the hemoglobinopathies, it is used to describe the disorders which is caused by the synthesis of abnormal hemoglobin. That means abnormal hemoglobin is present maybe because of substitution of amino acids, which is called as qualitative hemoglobin type, and insufficient quantities of normal hemoglobin. There will not be the change in amino acid sequence, but there is insufficient quantities of normal hemoglobin, that is called as quantitative hemoglobinopathies. So sickle cell anemia and hemoglobin C disease, these are the classical examples of abnormal hemoglobins. While thalassemias are caused by decreased synthesis of normal hemoglobin, that is quantitative, and sickle cell anemia and hemoglobin C disease are qualitative. Now if the chain is suppressed, that is level of all three hemoglobin A are reduced, it is alpha thalassemia. If beta chain is suppressed, adult hemoglobin is suppressed, that is called as beta thalassemia. So thalassemia can occur because of any defect in the information pathway, starting from the transcription to the translation. So thalassemias can occur due to variety of molecular defects, gene deletion or substitution, underproduction or inability of mRNA, defect in the initiation of chain synthesis and premature chain termination. Now these beta thalassemias are of two types, thalassemia major and thalassemia minor. If there is defect in the single gene, it is also homozygous, and it is the patient will suffer from actually this is change. If the major is when the defect is in the both gene, it is heterozygous, beta chains will be absent and hemoglobin A1 will be absent, and there will be decrease in the fetal hemoglobin and adult hemoglobin. There will be increase in the fetal hemoglobin and adult hemoglobin 2. While thalassemia minor, there will be defect in the single gene, it is homozygous, few or no beta chains will be there, adult hemoglobin either will be decreased or absent, and it will be increased. Now you can see these are normal RBCs and this is malformed RBCs. Age of representation is about 6 to 9 months, because we know that fetal hemoglobin is completely replaced by adult hemoglobin by the end of 9 months. So the patient will be presenting with pallor, that is anemia, jaundice, failure to thrive, gross motor delay, feeding problems, bouts of fever and diarrhea, and cardiac failure. Also there will be hepatomegaly, splenomegaly, frontal bossing will be there, maxillary overgrowth will be there, and hair-on appearance on the X-ray skull. So this may be due to excessive hemoptysis either in the liver, in the bone. So if there will be excessive hemoptysis in the bone, there will be skeletal deformities. Diagnosis can be done with the help of hemoglobin electrophoresis and HPLC. Also, DNA analysis for the alpha and beta chain mutation. Now you can see here the picture of the thalassemia patient, beta thalassemia patient. Frontal bossing is there. So the treatment is supportive care, blood transfusion and ion chelation therapy, avoidance of oxidant drugs, prompt treatment of infection, folic acid supplementation, splenectomy can be done, then bone marrow transplantation, stem cell transplantation and gene therapy also is given. Now the second type, that is alpha thalassemia. Normally 4 copies of alpha globin gene, that is 2 on each chromosome number 16 are present. If there is loss of one gene or both, there may be loss of one gene or both the genes. So there will be decrease in alpha globin production, and so there will be 4 types of alpha thalassemia because there are 4 copies of alpha globin gene. Here first one is the silent carrier. When only one type of gene is lost, the 3 genes are present normally. The patient will be asymptomatic. Then alpha thalassemia trait, 2 genes are absent. Hemoglobin H disease, 3 genes are absent, only 1 gene is present. And hemoglobin Bart's or heart drops fetalis means no gene is present. That is the patient, there will be stillbirth. So these are the symptoms. Alpha thalassemia, silent carrier, asymptomatic. Also thalassemia trait patient is also asymptomatic. Then hemoglobin H disease shows moderate to severe type of hemolytic anemia. Alpha thalassemia major, there will be, it is fatal and the baby will be born stillbirth. That is called as hydrops fetalis. Then we'll see sickle cell anemia. This is the qualitative type of hemoglobinopathies. It has got 2 normal alpha globin chain and 2 normal beta globin chain. This is due to difference in the only single amino acid. In this sickle hemoglobin S, glutamate at 6th position is replaced by the valine. That is, this is a hydrophilic amino acid and this is hydrophobic amino acid. This hydrophilic amino acid is replaced by the hydrophilic amino acid. This is the defect. This is the point mutation. Here you can see the GAG normally is present. This is hemoglobin A. Here glutamate is there, and in hemoglobin S, the A is replaced by U. That means glutamate is replaced by valine. This is at the beta chain of 6th position. Now, there is in hemoglobin S, there is if there oxyhemoglobin, that is deoxyhemoglobin, hemoglobin S, there are the presence of both the protrusion as well as receptor. So, in the absence of oxygen, that is whenever there is oxygen is absent, these deoxyhemoglobin will get attached to each other. These will get attached to each other, and there will be formation of fiber, and this fiber will distort the normal biconcave shape of the RBCs to the sickle shaped RBCs. You can see here normal red blood cells, and these are sickle shaped cells because of formation of this long inflexible chain of hemoglobin gets attached to the hemoglobin S get attached to each other. So there will be distortion of shape of the RBCs. Again, this is a point mutation. Now the clinical features are long life hemolytic anemia, tissue damage and pain, repeated infection, and premature death of the patient of sickle cell disease. Now, this is the significance of, sometimes it is sickle cell trait has got significance that it provides resistance to the malaria. That's why it is very common in the Mediterranean or tropical areas where the malaria is endemic. Diagnosis is done with the help of sickling test, a very simple test where a simple microscopic examination of blood is done with the help of blood smear is prepared by adding reducing agents to the sample such as sodium dithionate and sodium metasulfide, and it is observed under microscope. There you will observe sickle shaped RBCs. Then also diagnosis can be done with the help of, confirmed with the help of electrophoresis, which type of sickling disease is present, that whether patient suffers from sickle cell anemia proper or sickle cell trait. When subject to electrophoresis in alkaline medium, as because of hemoglobin S has got less negative charge. So there will be, because there is absence of glutamate, we all know, and so that carries negative charge. So it will be, it will move slower as compared to the adult hemoglobin. And HPLC also can be done to confirm the diagnosis and capillary electrophoresis. This is a picture in electrophoresis. This is normal, and in trait we'll get both the types, that is hemoglobin A and sickle means hemoglobin S, while in sickle cell disease only hemoglobin S, the band of hemoglobin S is observed. So the treatment is administration of sodium cyanate. It inhibits the sickling of erythrocytes. Then drug hydroxyurea, it also increases the concentration of fetal hemoglobin. So again, both has got same function, that it lowers the formation of deoxyhemoglobin S. In patients with severe anemia, repeated blood transfusion is required, and these are some abnormal hemoglobin, other hemoglobin C disease, lysine is replaced, hemoglobin D disease, glutamine is replaced, and hemoglobin E disease, lysine is there. Thank you so much.